Right now?
Yeah, it's recording.
Hello, my name is Kayla Thomas. I'm a nurse practitioner student through UND. Just washed my hands here, tried to warm them. What's your name?
Sean.
Sean. What brings you here today?
Check out.
Regularly pretty healthy?
Mm-hmm.
No health concerns or anything?
No.
Okay. Well, I'm going to start out by assessing your face and head here. Your facial features are symmetric. Your skin is normal color. I don't see any rashes or lesions. Your hair is appropriately not losing any hair or anything. Have you noticed any hair loss? Okay, I'm going to touch your head here, your scalp. Any pain when I do this?
No.
I don't feel any masses or bumps. Any pain when I press on your frontal sinuses here?
No.
How about your sphenoid
No.
and ethmoid?
No.
And your maxillary sinuses? No pain? Okay. Now I'm going to test cranial nerve number 7, the facial nerve. I'm going to have you smile for me, show me your teeth, frown, purse your lips, puff out your cheeks, blow it out. Good. All of that you did very easily, so your cranial nerve is intact. Next, I'm going to feel your temporal mandibular joint here. I want you to open and close your jaw. Good. Any pain with that? And I didn't feel any clicking. And move your jaw from side to side. Good. Okay. Next, I'm going to just look at your ears here. They're symmetric. Any pain when I touch on your pinea? Your auricle? No? Okay. Any drainage or anything in your ears? No? Okay. All right, I'm going to test cranial nerve number 8, the acoustic nerve. The first test I'm going to do is called the whisper test. I'm going to stand behind you and I'm going to whisper 3 words and I want you to repeat them for me. Can you plug your left ear? Basketball, football, baseball.
Basketball, football, baseball.
Okay, good. Actually, this bed is a little close to the... Okay, now have you plug your right ear? Monday, Tuesday, Wednesday.
Monday, Tuesday, Wednesday.
Good. Okay, the next test I'm going to do has a tuning fork involved. So this is a vibrating tuning fork. I just hit it and it vibrates. This one's called the Weber test. I'm going to put it in the middle of your head. I want you to tell me if you feel the vibrations to both sides equally or one side or the other more. Okay?
Equal.
Okay, good. The next one is the Renee test. I'm going to put the tuning fork behind your ear, and I want you to tell me when you can no longer feel or hear the humming.
No.
Can you still hear it?
Yeah.
Tell me when you can.
No.
Okay. This is testing ear conduction versus bone conduction. It should be a 2-to-1 ratio, and it was. You easily heard the ear conduction twice as long. Okay, I'm going to do the other ear.
No.
Can you still hear it?
No.
Okay, good. Okay, next I'm going to look in your ears. You haven't had any issues, you said. Okay, all right. Just going to pull up and back here. Good, and I'm visualizing his tympanic membrane is pearly gray. I can see the umbo And behind that I do see the malleus, and I don't see any edema, any drainage or anything. And very minimal cerumen, so do the other ear here. Good, again, very clear, pearly gray, and I can visualize the umbo and also the malleus behind that. That's great. Okay, we're gonna move on to your eyes now. Do you wear glasses or contacts?
No.
Any problems with your vision that you've noticed? Okay. Well, then the first test I'm going to do is the Rosenbaum test. This is a card. It's going to be about 14 inches away from your face here. I want you to cover your right eye and read the lowest line you can for me.
93782
Okay. Okay, and then cover your left eye and do it again.
428739.
Okay, and now with both.
428739.
Okay, you're 20/20 with both, and your right eye, you were 20/25, left eye 20/20. Okay, next I'm going to inspect your eyes. I look, your sclera is white, your pupils and irises are symmetric, equal shape, no bulging, no redness in your eyes or anything. I'm gonna have you close your eyes. Your eyelids are smooth, no lesions. You have equal eyelash distribution. Your eyebrows are symmetric, normal hair distribution there too. Okay, I'm gonna have you open and look up. And your conjunctiva are pink, moist, no edema. They look fine. Any pain when I palpate on your lacrimal gland here? Okay. Now I'm just gonna inspect the lateral aspect of your eyes. I'll just have you look forward. And you have nice concave, no bulging, no cloudiness. It's clear. Looks good. And your sclera is white. And move this side. Also the same. Concave, clear, no bulging. Okay. Next I'm gonna just have you look straight ahead for me. I'm gonna do the corneal light reflex. Good. And his pupils did constrict equally to direct and consensual light. And just one more test. I'm gonna look here. Corneal light reflex here. The light appeared on the same portion on each eye in the same place. So that was a positive corneal light reflex. If that was negative, we would do a cover-uncover test, and which we will do in this case. We wouldn't need to. Usually we do it for an abnormal corneal light reflex. But I'll have you cover your right eye, and I want you to look at my finger and remove the card. Good. And he did accommodate. So when he removed the card, his other eye was looking so that both eyes were looking at the same place. So now cover your other eye, look at my finger, now remove the card. Again, it did accommodate. Good. Next I'm going to test cranial nerves 3, 4, and 6. I'm going to test your 6 cardinal fields of gaze. So I want you to follow my finger. And up, and down, and in. Good. And you did have convergence there as you tried to follow my finger in toward your nose. I didn't see any extraocular movements. I didn't see any nystagmus. And you did that relatively easy. The next, I'm going to test your peripheral vision, or your peripheral fields. This is part of cranial nerve number 2. I want you to tell me when you can see my fingers.
No. 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 No.
Good. Okay, and the other part of cranial nerve number 2 will be doing an eye exam here. the lights here. Actually, okay. All right, I want you to just look over my left shoulder. I'm gonna get kind of close to you here. Oh, looking for the red reflex. I see it right away. Just following it in. I do see blood vessels. I'm trying to follow those blood vessels to see an optic disc. The optic disc should be a yellow circular. Oh, and I do see it. Good. No abnormal vessels or anything. Sorry. Kind of let you blink there for a little bit. Okay, now I'm going to inspect the other eye. Just look over my right shoulder. Again, I'm following that red reflex in. Again, I do see blood vessels. Okay, good. Your blood vessels were, didn't look constricted or anything like that. It looked normal inside. So that was good. Okay. Okay, we'll move on to your nose then. Do you have any problems breathing? Okay. I'm going to have you occlude one of your nostrils and take a sniff in to see if it's patent. Good. Then your other one. Okay, good. So the next test I'm going to do is cranial nerve number 1, the olfactory nerve. So I'm going to have you close your eyes and I'm going to put a scent in front of your nose. I'm going to have you occlude or plug one of your nostrils. Okay, and what do you smell?
Cinnamon.
Good. And plug the other nostril, close your eyes.
Coffee.
Good. All right. Okay, next I'm going to look in your nose. You haven't noticed any recent drainage or anything?
No.
Okay, and we did palpate your sinuses earlier in the exam and that didn't elicit any pain. Okay. I'm just gonna look up here. Good. Your turbinates are pink, moist. There's no lesions, no crusting, no bleeding, no drainage. They look good. Okay. Let me know if it gets uncomfortable. Okay. Here too, good. Turbinates are again moist, no drainage. They're pink. No issues there. Okay. Good. Okay. Next, I'm gonna get some gloves here. And I'll leave it too. Inspect your mouth. You haven't noticed any difference in taste or anything like that? Okay. When I did look in your nose too, I didn't see any deviated septum or anything. Everything was appropriate. Okay. So I'm gonna have you open your mouth, please. I'm just gonna touch inside here on your gums. Any pain when I touch on your gums? Up here? No? Okay. You have all of your teeth. They are in good condition. Do you go to the dentist? That's good. Okay. Have you open up again? All right. I don't see any sores. Your oral mucosa is pink and moist. Have you stick your tongue out for me? Your tongue is soft. Color is normal. I'm going to have you move your tongue side to side. Good. That's testing cranial nerve number 12, the hypoglossal. And your tongue movement was good with that. Just going to use this light here. I'm going to have you open. And Can you say ah? Good. I'm looking for his uvula and his palate to rise, and it did. And then I'm going to stick your tongue out a little bit more. Just checking his tonsils. They're of equal size and shape. There's no lesions or swelling. His tonsils look fine. Okay. And I would test cranial nerve number 9 and 10. That is the gag reflex. So what I would do, we're going to defer it in this exam, but I would use a tongue depressor and stick it far enough in his throat to elicit that gag reflex. In addition, another reflex that we did defer in his eye exam is the corneal reflex, which tests cranial nerve number 5. And we would actually touch his eye with something to elicit that blink response. So we did defer that also. Okay, the next, then I'm going to move on to your, I'm just going to watch this real quick. Neck. Okay. First, I'm just going to inspect your neck. I'm looking for any jugular venous distension, and I don't see any here sitting. Okay, and your color of your neck is constant. It's normal color. I don't see any masses or bumps or anything like that. I'm just going to look for your trachea to be midline. I'm going to palpate your trachea. I'm going to feel your hyoid bone and your thyroid around it. You haven't ever had problems with your thyroid? Okay. I'm going to try to feel your thyroid. To do this, I'm going to have you swallow a drink of water. I'm going to displace your thyroid gland to one side and feel it with the other when you swallow. It'll lift your thyroid when you swallow, okay? All right. Okay. Take a drink. Good. It was relative shape, no nodules, it was smooth, it was appropriate size. Okay, so I'm going to do the other side. Just place it this way. Okay, take a drink. Good. Again, no nodules, smooth, and normal size and shape. Okay, just going to do some range of motion of your neck. I'm going to have you look all the way to your right, to your left, up to the ceiling, down to your chin to chest. Now up, put your right ear to your right shoulder, and left ear to left shoulder. Okay? Now I'm going to have you turn into my hand with resistance. Good. And this side. Good. Now I'm going to have you shrug your shoulders against my resistance. Good. And again. Good. That tested cranial nerve number 11, the spinal accessory nerve. It also tested the strength in his sternocleidomastoid muscle and his trapezius muscle, and all was appropriate. Next, I'm going to feel your lymph nodes in this exam. Your preauricular, your postauricular, your occipital, your parotid, your retropharyngeal, your anterior cervical chain, your posterior cervical chain, your supraclavicular, your infraclavicular, your submental, your submandibular, your epitrochlear, and then for your axillary, I'm going to have you just bring your arm up like that and feel down here. Good. You haven't noticed any swelling or
No.
any of your lymph nodes? I haven't felt any lymph nodes or any swelling, so that is good. I'm just going to feel your carotid pulses here. Good. both equal, rate and rhythm, +2, no bounding. Next I'm going to listen to your carotid pulses with the bell of my stethoscope for bruits. That's just an indicator of abnormal vascular flow. Take a deep breath in. Exhale. Good, and I did not hear any. This side, take a deep breath in. Good, okay. Right. Then I think we will move to your chest. I'll have you take your gown down. Okay, here. Okay. All right, so I'm just going to inspect your chest. It's regular color, no rashes, again, no lesions. I do see some moles generally in a few areas, but they don't look abnormal. You do skin self-checks. That'd be a good thing to do, just to check for skin cancer. Okay, normal hair distribution for a man. So I will just palpate your chest. Does this cause any pain at all? I'm gonna palpate that. Any pain?
No.
Okay. Now I'm gonna test your respiratory expansion. I'm just gonna have you take a deep breath in and exhale. Good. And back. Take a deep breath in. And exhale. Good. And I'm just looking for a symmetrical of my thumbs going out and coming together when he breathes in. And it was. Okay. Next, I'm going to do what's called tactile fremitus. I'm going to touch your chest in a few different spots, and I want you to say 99 every time I touch your chest.
99. 99. 99. 99. 99. 99.
Good. And I'm just feeling for the vibrations in each lung field to be symmetric, and they were. Okay, next I'm going to percuss your chest. And I'm hearing resonance, which is a normal finding. Good. Now I'm going to test your diaphragmatic excursion. So this is just a measurement of your tidal volume, or how much air that you can hold in your lungs. So I'm just going to have you take a deep breath in and hold it in. Good. Okay, you can breathe out, breathe normal. When you're ready, I want you to take a deep breath in and then hold that exhale out. And hold it out. And it's 7 centimeters, which is good. It's appropriate for your age. That's a good tidal volume. Okay, next I'm going to listen to your lung fields. So I'll just have you take some nice deep breaths for me. regular breath sounds, which is normal. They were clear to all lobes. There were no adventitious sounds such as wheezes or crackles or rails. Okay, so next I'm gonna just palpate around your heart. I'm gonna palpate at the apex, the left lateral sternal border, and the base. And I'm just palpating for any heaves, thrills, or lifts, and I didn't feel any. Next, I'm going to palpate your apical pulse, and it should be mid-clavicular line around the 7th intercostal space. I'm going to have you just kind of sit erect for me. And I do feel his apical pulse. Good. Next, I'm going to listen to your heart sounds at the aortic valve, the pulmonic, second pulmonic, the mitral, good, and the tricuspid. And I'm just hearing an S1, S2, no adventitious sounds right there. Regular rate, no murmur. So now I'm going to have you lie down. Okay. And while he's at this 30-degree angle, I'm just going to look for any venous or jugular venous distension. So move this pillow out of here. And I'm going to have you look over toward the window. Good, and there is no venous distension. And I'll have you look the other way. Good. Okay, and I'll put your head down. Then again, I'm going to palpate those same areas again. So I'm going to palpate the apex, the left sternal border, and the base. And I do not feel any heaves, thrills, or lifts. And I'll feel your apical pulse again. Yours is easy, especially lying down. Good, regular rate and rhythm. Okay, I'm gonna listen again. This time I'm gonna listen with the bell of my stethoscope because it sometimes can detect different sounds. Okay, over the aortic, the pulmonic, the second pulmonic, the mitral, and the tricuspid. Good. Again, S1, S2. Then I would put you in the left lateral recumbent position, where you would lay on your left side, and I would listen to those areas again, but we'll defer it in this case. Okay, so next I'm just going to feel your pulses. I already felt your carotid pulses earlier in the exam. Next I'm going to feel your brachial pulses. Good. And your radial pulses. And your popliteal pulses. Good. And your posttibial. Good. And your dorsalis pedis. I'm also just going to put some gloves on and feel your femoral pulses too. Good. Okay. Okay, I'm just gonna kind of inspect your extremities for color and temperature. They're nice and warm. The color is good and equally distributed throughout. Normal hair distribution again, and warm. There's no lesions, no rash, no cyanosis anywhere, and your toenails are in good condition. I'm gonna look at your hands here and your nails. Sometimes that can give you a clue to some vascular issues. There's no clubbing on any of his fingernails. I'm going to check capillary refill, and they're very brisk, less than 2 seconds. That's good. Okay, good. So next I'm going to move on to your abdomen. As far as abdominal pain, have you had any regular bowel movements? Yeah? Everything's good. Okay. So first I'm going to inspect your abdomen. I'm just kind of looking for any bulges or masses. I don't see anything. Your hair distribution is good. The color is good. So next I'm going to listen. In all 4 quadrants here. Good bowel sounds heard in all 4 of those quadrants. I'm actually going to listen over your spleen and your liver for any friction rubs. Your liver here. Okay, and I didn't hear any. Okay, then next I'm going to percuss your abdomen. And I'm just hearing tympani, which is a normal sound to hear over the abdomen there. Next I'm going to percuss your liver. So I'm just going to start down here. I'm waiting for it to change from tympani to dull. Work my way down here. About almost 8 centimeters, which is normal. In adult, it should be between 6 and 12. So that is normal. Okay, so next I'm going to do some light palpation. Any pain when I touch on your head? Okay. How about around your umbilical ring here? No? Just feeling for any granulation, any bulging, protrusion, or herniation, and I don't feel any. Okay. All right, so now I'm going to palpate your spleen here. Have you take a deep breath in, and exhale. I do feel his spleen, the edge of it here. Okay. Now I'm gonna test, see if I can palpate your kidney. I'm gonna try to sandwich it here. Have you take a deep breath in, exhale. Good. I can't feel his kidney, which is a normal. And then on this side, deep breath in, exhale. I do not feel his kidney here. Then I'm gonna palpate your liver. So I'm gonna have you take a deep breath in, and I'm gonna try to kind of hook under your ribs here. Feel it. Good to your liver there. Good. Then I'm going to palpate your aorta here. I do feel it here. There's no bounding or anything. Okay, good. Then I'm going to listen for any bruise again. The bell. Listen on your aorta and your renal arteries. your iliac arteries. And your femoral arteries. Good. I'm gonna grab some gloves again. And just feel your inguinal lymph nodes. I don't feel any, so it's good. Okay, then the last thing, as far as your abdomen, I'm going to do an abdominal reflex. So I'm just going to stroke kind of outward on your abdomen here. And I'm just kind of looking for his belly button to kind of quiver toward where I'm stroking, and it does. Okay, good. Okay, now you can go ahead and sit up. All right, we're just gonna do some range of motion exercises. So I'm just gonna do some forward flexion up with your arms and hyperextension back. Good, and abduction out and adduction in. Good. And we'll do some internal rotation with that and external rotation. Good. Good range of motion there. You did that quite easily. Are you fairly active? Yeah. Okay. You can go ahead and lay down. Of course, in his instance, since he is active, it's easy to do all these. I would tailor my exam if someone had problems with their range of motion or had a deficit. Okay, so we'll do your hips now. So I'll have you just lift your right leg up high, yep, and then down, and then adduct out, adduct all the way in and over, yep, and then your knee to your chest, flex, and then I want you to do heel to your knee and down your shin, good. And then the other leg up and adduct out, or abduct out, excuse me, adduct over in, and then knee to your chest, and then your heel from your to your knee down. Good. All right, you can go ahead and sit up again. Yep. Okay, now you can go ahead and stand up. I did see you walk in here, so you did have no problems with gait, but it's a little small in you, but I'm just going to observe if you want to just kind of walk back and forth. Good. Posture is good, his gait is good. Very even and easily. Next, I'll have you just walk on your tiptoes. Good. Now on your heels. Good. And then do heel to toe. Good. Okay, next I'm going to test your balance using the Romberg test. So I'm going to have you just kind of put your feet together, hands at your sides. I want you to close your eyes, observing for any swaying. And he does that pretty easily. You can open your eyes. Did you feel any? No? Okay. Can you hop on one foot? Good. And the other one? Good. Good. Now I'm just going to check out your back here while you're here. Just palpate its midline and normal curvature. I'll have you bend down. Good. And again, normal curvature, no swaying. Okay, you can go ahead and sit up. I'll have you sit down for a second. There's one exam that I wanted to do. CVA tenderness. When I was back here, I'm just going to kind of, you'll feel something back here. I want you to tell me if it's painful or not, okay? Pain?
No.
Okay. Any pain there?
No.
No? Okay. That would test if you had an enlarged kidney, so urinary tract infection or kidney disease would elicit a painful response. Okay, your gait was good. So I think now we'll test some cerebellar function. So I'm going to have you just put your hands in your lap, palms up, and then I want you to turn them down and up, and then do it faster and faster. Good. Now I want you to touch your finger to your thumb, each finger to your thumb, and then keep doing it faster and faster. Good. Now I want you to touch your nose, and then touch my finger. Touch your nose, touch my finger. Touch your nose, touch my finger. Touch your nose. Good. Now I want you to touch your nose out, and then other, out. Like that. Faster. Good. So your cerebellar function is intact. Next, I'm just going to test your primary sensory function. And by this, I'm just going to do some sharp and dull testing. So I just want you to close your eyes, and this is dull, and this is sharp, okay?
Sharp. Dull. Sharp. Dull.
Okay, good. You can open your eyes. And I just have a cotton swab here. I want you to close your eyes, and I'm going to touch your face. I want you to tell me when you can feel it.
No. No. No.
Good. Now I'm going to do what's called 2-point discrimination. I want you to tell me if you feel 1 point or 2 points.
2. 2. 1. 2. 2. 1.
Good. And that's what should happen as I bring them closer together. You can only discriminate 1, which was normal. Next, I'm going to use the tuning fork again. And it'll vibrate, and I just want you to close your eyes and tell me where you feel the vibration, okay?
Finger. Wrist. Elbow.
Good. Okay. I want you to close your eyes, and I'm going to take your hand, and I want you to tell me if your finger is going up or down.
Up. Down. Up.
Good. And that's cryoperception, which was intact. Next, I'm going to test your cortical sensory nervous system. And by this, I'm going to do stereogenesis. So I'm going to have you close your eyes. I'm going to put an object in your palm, and I want you to tell me what it is.
Quarter.
Yep. You can open them. And your other palm, I'll have you close your eyes. I'm going to put another, and tell me what it is.
Paperclip.
Got it. And the next is graphesthesia, and I'll have you close your eyes again, and I'm going to draw something in your hand. I want you to tell me what it is.
8.
Okay. This hand.
T.
Good. Good. Okay. So the last thing I'm going to do then is your reflexes. So I'm just going to do one side for this exam. Just kind of loosen your thing. Good. And that was your biceps. I'll have you bend your arm here, and we'll do your triceps. Good. And your radial. Okay. And I'll have you sit up. We'll do your patellar. Good. I'll have you lay down. And we're going to do your Achilles. Good. And then the last reflex is the Babinski, or the patellar. So I'm just going to stroke your foot here. Sorry. And I'm just looking for any abnormals. An abnormal finding would be if his toes fanned upward like that. Okay, you can go ahead and sit up. Do you have any questions for me?
No.
That completes our exam. Thanks for coming in. All right, thanks.